Hey, it's Dr. J, Toronto Spine and Sports Clinic. So I'm in the office today, answering some phone calls, calling up on my patients just to check on how everyone's doing. Thought I'd take this opportunity to throw together this quick video. I've been having a lot of questions come in through emails, through phone calls about the difference between spinal decompression, traction therapy, and inversion tables. So let's dive right into it. There's two aspects you need to consider when discussing the appropriate treatment. Number one is how specific is it to your condition? And number two, how sensitive is it to your body as we're going through these ongoing changes? So let's talk about inversion tables. Inversion tables in terms of specificity. Basic. What do you do if you have a neck issue? Hang upside down. What if you have a mid-back issue? Hang upside down. What if you have a low back issue? Hang upside down. Right there it tells you not specific. So it won't be specific to your condition. In terms of sensitivity, when you're hanging upside down, whenever anything gets pulled apart, your body gets pulled apart, what happens is the muscles automatically start to tighten up. Okay? If I was to grab your arm and pull it away from your body, you're automatically going to fight back because our body doesn't like to be pulled apart. So in terms of sensitivity, it's not very sensitive either. So one other thing that I like to talk to patients about when they decide on an inversion table is you need to discuss with your family doctor before you're hanging upside down. There's a lot of contraindications to inversion tables, especially when you're over 40, 45, 50. So you want to make sure that you had that discussion with your family doctor. Now, let's talk about traction. There's two types of traction. There's manual traction, which is done by a therapist, and then there's automatic traction, which is done by a machine. When it comes to manual traction is a little more specific because the therapist can actually focus on a specific spot. And they can put most of the therapy to that area where you need it. In terms of sensitivity, the consistency of the treatment or the force being put into place is not always consistent. It won't always be the same. And also, in terms of sensitivity, the therapist doesn't really know if they're hurting you or if they're pulling the tissue enough or anything like that. It's purely subjective based on what you're feeling and what the therapist is feeling. Now, in terms of automatic traction in terms of specificity is a little bit higher than an inversion table because you can focus on either the neck or the lower back. But in terms of sensitivity, the machine is pulling. There's no feedback mechanism. So it's not telling you if the force is going to the muscles, fighting as in a tug of war between your muscles and the machine, or if the force is going to the actual area that needs treatment. In terms of decompression allows us to be extremely specific. We could target about 80% of force to the disc that needs it. We could target the neck, we could target the low back. In terms of sensitivity, decompression has a feedback mechanism where it's monitoring your body as you're going through therapy. So if your body actually starts to resist what's happening and starts fighting the machine can sense that. And what it ends up doing is reducing the pull, allowing your body to relax, and then it starts to increase the pull again as your body's relaxed, which allows more of the force to go to the area rather than to the muscles and that tug of war happening. So I hope this gives a little bit of insight into the difference between the three types of therapy. I will dive a little bit more into how decompression works a little bit later, but hopefully this answers all of your questions. Until next time, this is Dr. Jamal. I'm a chiropractor, and yep, we do that.